Hello, welcome to Learning Thursdays. I'm Dave Kruder, a trainer with the OASAS Learning and Development Unit and your host for today's presentation. Before the presentation begins, I would like to make you aware of a change in Learning Thursdays for this year. 2017 is the Year of Ethics and is the focus of Learning Thursdays. Each month we will offer a core concept of ethics as developed by OASAS's Counsel's Office. This year-long series is facilitated by Trish Allen, who was an attorney with the Counsel's Office, and also with Maria Passeri, who is the director of OASAS's Bureau of Addiction Treatment Centers. There will be months this year where we offer both the Ethics series and an additional Learning Thursdays presentation, allowing our viewers both new information and additional clock hours to be available. This also supports the intent of the Learning Thursdays educational series as described in slide 1, where Learning Thursdays is offered to addiction professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals in prevention, treatment, and recovery services. A goal of Learning Thursdays is to support and help advance the educational and professional competency development of the treatment, prevention, and recovery workforce. A competency being comprised of knowledge, skills, and attitudes relative to a task. In part, we do this by offering monthly presentations that highlight content and topic areas that are current and relevant. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can use the same mailbox to express your interest in offering a future Learning Thursdays presentation. At this time, I will introduce this month's presentation titled Year of Ethics, Caregiving, Ethical Empathy, and the presenters Trish Allen and Maria Passeri. Welcome, Trish and Maria.
Thank you, Dave.
Thank you.
Happy to be here. So we, again, would like to welcome you to the third edition of Year in Ethics. Today we're going to be talking about caregiving and ethical empathy. I'm here with my co-host, yes. Maria Passeri. So I am going to turn it over to Maria. First, I would like to remind you, if you do have any questions, please feel free to send them to learningthursday@oasas.ny.gov.
Okay, so as a result of this training, counselors and practitioners will be able to, first of all, define empathy and the practice of empathy in the treatment setting. They will be able to identify 4 elements of caring and how they apply to the daily work responsibilities, and understand what constitutes personal moral qualities and good quality care. We also will be able to understand how stereotyping and assumptions we make about our patients can result in poor responses and affect the therapeutic relationship. And last but not least is we always want to understand how professional ethics relate to the CASAC Code of Ethics and the New York State Justice Center. So in starting with the definition, we have to understand that the basic building blocks of ethics and ethical conduct towards others is empathy. And the definition of empathy is feeling that you understand and share in another person's experience and emotions, and the ability to share someone else's feelings. We have to remember that it's not sympathy, it's not feeling sorry for someone, it's the foundation we use to develop the therapeutic alliance. And the therapeutic alliance is critical in providing effective care for our patients. So without empathy, it's difficult to understand the needs and wants of others, treat others kindly and generously, also to provide care to our patients in our day-to-day relations. So without it, we're more vulnerable to ethical misconduct. I want you to consider now the practice of empathy. And in the research, it talks a lot about the practice of empathy, and that for people in work situations, They may become more manageable and less stressful if they practice empathy in their daily interactions. And we also know that stress can impact how we respond to the multiple needs and behaviors of our patients. So it really goes beyond this training in terms of we can't just teach ethics, we also have to understand how to manage stress on the job, and that will help us, in effect, reduce the misconduct incidents at your particular facility. There are obstacles to ethical empathy. There's a blindness that we have in regard to the feelings of people who are different from ourselves. The effectiveness of evidence-based practices are based on the therapeutic relationship. So it's really important to understand that we can't have effective evidence-based practices unless we have that therapeutic relationship. So we have to be genuinely engaged in the therapeutic relationship. We have to have unconditional positive regard for the patient. We also have to feel empathy for the patient and clearly communicate these attitudes. And when we talk about those attitudes, those are the behaviors that we're looking at. When I took a look at the research with nursing, nursing has a lot of research around the phases of caring. So caring for others isn't just something that we do. There's a body of research along with that. There's a feeling and exhibiting concern for empathy of others by showing or having compassion. So the phases of caring include caring about someone, recognizing the need, sometimes before the patient even knows what they need. Also, taking care of the responsibility to respond. So that's our role. What is our role in the treatment center, and how are we going to respond in that role? Third is caregiving, actually taking action. And last but not least, how was our action? Was it successful? Was the client satisfied? Or does the client still need something further from us? So going back to what are those 4 elements of effective caring? First one be attentiveness. So are we paying attention to the patient? Are we hearing what they have to say? Are we listening to what they need? We also have to take responsibility. What is our role? Is our role professional in that it's a counselor, a nurse, a physician? We also have to have competence in what we're doing. We have to know what we're doing in the role that we're participating in the treatment setting. And last but not least, the responsiveness of the caregiver. How is the patient behaving? That's giving us an indication of our ability to care for them. In dealing with ethics and empathy, there are moral qualities that we must possess as counselors, as nurses, as physicians or practitioners. Empathy, as we talked about, is the ability to communicate understanding of another person's experience from that person's perspective. Also, it includes sincerity, a personal commitment to consistency between what is professed and what is done. And that's kind of the basis of counseling when we talk about Rogerian theory. We have to have that genuineness, and our patients pick up on that genuineness and that sincerity. They know when we lack that. Integrity is also important, which is the commitment to being moral in the dealings with others, personal straightforwardness, honesty, and coherence. But that goes along with, and I'm going to step down to one, respect. Because if we're being straightforward with our patient, we also must be respectful in showing the appropriate esteem to others and their understanding of themselves. And it goes both ways, because sometimes our patients aren't respectful to us. However, we have to maintain our respectfulness to them. Resilience is important because it's the capacity to work with the client's concerns without being personally diminished. Working with our patients is very difficult and it is exhausting, and we'll talk a little bit about empathy fatigue as we move on in the presentation, but we also have to have that strength each day to spend time and have the patience to work with our patients. Humility is always important. It's the ability to assess and accurately acknowledge one's own strengths and weaknesses. And sometimes our patients have to see us for who we are. And we have to be honest with ourselves while we're working with our patients on a daily basis. Competence is very important, as we've talked about with caring. It's the effective deployment of skills and knowledge needed to do what is required. And it's also important to recognize that being in recovery ourselves doesn't mean that that is enough. We have to go beyond that understanding of being in recovery and understanding the skills we need to do the work that we have to do with our patients. Fairness, the consistent application of appropriate criteria to inform decisions and actions. Wisdom, which is the profound sound judgment that informs practice. And last but not least, the courage, the capacity to act in spite of known fears, risks, and uncertainty. And all of these moral qualities need to be addressed during the supervision process. We can't educate enough in terms of how we supervise our staff, how important supervision is, because when we don't get supervision, we are spending time doing the reactive activities when our patients are acting out, and sometimes our staff is acting out in the same way. So supervision is something that we will talk about at each one of these presentations on a monthly basis. And now I'm going to turn it over to Tricia for ethics and law.
Thank you, Maria. So, you know, the whole goal of the Year in Ethics program is to pick an individual facet of ethics and speak about how the ethics and with the rise of the Justice Center, how those interplay in our everyday practice when we're interacting with our patients. Because obviously, a significant portion of this is understanding how ethics gets created, how the structures that we're all subject to get created to promote the best possible outcome for our patients. Our expectation is that we provide care as addiction professionals in order to assist people in achieving recovery. So this is just a little bit of a segment to talk about how those intersect. So when we talk about ethics in the law, how do we really know what's right and what's wrong? You know, everybody has their own opinion about what's right and what's wrong in any given situation based on their perspective. And it essentially comes down to what's good and what's evil to greater or lesser degrees. So the real determination of moral correctness is in an action is how it affects the people involved. So how did the parties perceive it? How were they impacted by it? What was the motive for whatever the action was, and what was the desired outcome or the actual desires of each individual who was involved? And ethics in the law, so this is a continuation of right versus wrong. Each individual person is different. Everybody has different opinions. Everybody has different perceptions. So we need to ensure that we are acting in a way that addresses the concerns of each patient, and that's part of why it's so crucial when we speak about empathy. Because no two individuals are exactly alike, we can't be certain that the same actions towards one person will be equally ethical, you know, towards another person. It's not always equally perceived. So one of the things that I did want to bring up, and you'll see I covered a couple of different licenses in the following slides. The first is the CASAC Canon of Ethics. Obviously, as OASAS, we license and manage this, or we oversee and manage this credential, so we obviously know quite a bit about it. But I did want to point you to a common theme that you'll see throughout CASACs as well as nurses and other mental health professionals. Some of the common themes that focus on respecting values, and I think when we talk about empathy and having the ability to understand and share another person's experiences and emotions is to have respect for them and to always interact with them in a way that shows a respect for their dignity and preserving their dignity, because obviously we're working with people who have been through difficult circumstances in life and are trying to come back from that, and if we are anything, we are absolutely an agency that is focused on recovery and you know, starting over, starting anew. So the CASAC Canon of Ethics provides a couple of different standards. The first is that we respect the values, attitudes, and opinions of others, and I think that speaks not just to our colleagues but also our patients, because they are coming to us for help, and they obviously have come from a different vantage point than we ourselves have, so they present a different perspective. Another portion of the CASAC Canon of Ethics requires or prohibits discrimination, and that's based on any type of race, religion, age, gender, disability, ethnicity, national origin, sexual orientation, or economic condition, among any other currently unstated or future prescribed biases. So, you know, it's I think a common theme that focuses on or maybe tries to address issues that can come up that could possibly inadvertently impact your ability to have empathy with someone. We also focus very much on respecting the integrity and protecting the welfare of the person in treatment or the group that you're working in. You know, obviously, if you're struggling with empathy and you're working with a client, you may be more inclined to respond maybe inappropriately or respond rashly to when a client is going through a difficult period, or maybe they're acting out. So, you know, we focus very heavily, especially in the CASAC Canon of Ethics, on preserving respect and showing respect for the individual person as well as the group. And then, of course, there is the expectation that a CASAC won't engage in behavior that is harassing or demeaning, and included to, but not limited, sexual harassment. So in addition to the CASAC Canon of Ethics, there's also the CPP or CPS Code of Ethical Conduct, and these are similar to the CASAC Canon of Ethics in that there is a prohibition against harming service recipients. There is a focus on the practice of a CPP or CPS individual being respectful and non-exploitative of service recipients, as well as protecting the recipients from harm and also protecting the professional and the profession from censure. Similar to the CASAC Canon of Ethics, there is also a prohibition against any type of discrimination and an ongoing obligation to ensure competence. So CPPs and CPSs shall broaden his or her understanding and acceptance of cultural and individual differences, and in so doing, render services and provide information sensitive to those differences. So recognizing those different viewpoints and trying to share in that other person's experiences and emotions and understand them. Along the same vein as the Nursing Code of Ethics, which I selected Provision 1, and this focuses on the nurse practicing with compassion and respect for the inherent dignity, worth, and unique attributes of every person, and just an overall tenet of having a respect for human dignity. This is discussed as a fundamental principle, and it's absolutely something that informs all nursing practices, and I believe Maria referenced it earlier. Just in having respect for the inherent dignity and the unique attributes and human rights of every single individual that a nurse comes into contact with, really. So the next code of ethics is actually the social worker code of ethics. And again, I focus very much on the emphasis on dignity and worth of the person. So the ethical principle states that the social workers respect the inherent dignity and worth of the person, and that includes treating each person in a caring and respectful fashion, mindful of individual differences and cultural and ethnic diversity. Also promoting the client's socially responsible self-determination. So it's a thread that I think runs throughout all of the professions, really, is recognizing the need to, accept the individual's differences, and in accepting that also working to assist them respectful of those differences. And these are the Social Worker Code of Ethics ethical standards. So there are prohibitions similar to CASAC Canon of Ethics, which prohibits discrimination in their practice, and also condoning, facilitating, or collaborating in any form of discrimination against an individual based on race, ethnicity, national origin, sex, sexual orientation, color, gender identity or expression, age, marital status, political belief, religion, immigration status, or mental or physical disabilities. And then there's also the prohibition against the use of derogatory language in their written or verbal communications to or about clients. And this feeds into the practice of ethical empathy, but I think it also feeds into the impact of lack of empathy in circumstances where a addiction professional maybe is suffering from empathy fatigue, which Maria will touch on later, or where they are struggling themselves. It can lead to a violation of this ethical standard and could perhaps lead to derogatory language. So the next code of ethics that I included is the Mental Health Counselors Code of Ethics, or the AMHCA. And this is included in the client's rights, and it's an expectation that all mental health services, wherever or however they're delivered, clients have the right to be treated with dignity, consideration, and respect at all times, and that clients have the right to expect quality service provided by concerned, trained professionals and competent staff. Another credential that I did actually include in here is the Serpa, or Certified Peer Recovery Advocate Professional Standards. I thought that it was important because we, as a field, have begun, I think increasingly so, to incorporate the use of peers into our treatment programs, and there is a significantly increased interaction between peers and clients, so I did want to include this. And this is a standard which says, similar to what the other standards have said, a certified professional shall not in any way participate in discrimination on the basis of race, color, sex, sexual orientation, age, religion, national origin, socioeconomic status, political belief, psychiatric or psychological impairment, or physical disability. The expectation that you receive competent services from staff and the requirement to be respectful of patient dignity is not something that we've just included into the Canon of Ethics for our CASACs. It's also something that we have included in our patient rights. So this is something that applies across the board for, I would say, licensed individuals or not, anyone who's working in our program. A patient has a right to expect to receive services from provider staff, all provider staff, that's competent, respectful of patient dignity and personal integrity, and in sufficient numbers to deliver needed services consistent with the provider's operating certificate, as well as being treated in a therapeutic environment that is safe and free from the presence of alcohol or other addictive substances, and in an environment that's free from physical, verbal, or mental abuse. And I touch on that because I think in some of the worst cases we've seen what the lack of empathy has led to, or could lead to, feasibly could be some form of verbal or physical or mental abuse. And I mentioned that because that is where the Justice Center comes in. As we all know, the Justice Center came about in 2013. And since then, we now have additional laws in place, both in social services law as well as in our regulations, which speak to conduct by a custodian, which is pretty much anybody in a treatment program who works for the program and or is a volunteer who is intentionally or recklessly causing some sort of verbal or nonverbal action, and that causes some sort of decrease in the service recipient's emotional, social, or behavioral development or condition, or has a likelihood to cause it. So what are examples of this? Intimidating patients, making threats towards a patient. If you're displaying a weapon and you're displaying it as a way to say, I'm gonna hurt you or injure you in some way, taunting a service recipient or a patient, or making a derogatory comment or making fun of them. So that's a very technical way of saying that you maybe are threatening them, or you are saying you're going to hurt them in some way. So part of the Justice Center structure is the possibility that there can be a Category 1 abuse and neglect finding, and this is contained in social services law. And this says that if an individual, a custodian, somebody who works with a program, knowingly, recklessly, or criminally negligently fails to perform a duty that results in substantial and protracted decrease in the service recipient's psychological or intellectual functioning, that can, or it's likely to result. So that is what a Category 1 finding for psychological abuse is. And that can include threats, taunts, ridicule. It can also include engaging in or encouraging others to engage in cruel or degrading treatment. So there's very much a focus in the Justice Center structure and in the OASAS structure on the failure to recognize patient dignity and acting in a manner that's inconsistent with that, such as cruel and degrading physical contact of a service recipient. And again, it's got to end up resulting in some sort of substantial or protracted decrease in the service recipient's psychological or intellectual functioning. Okay. So I think I'm going to turn it back over to Maria.
Thank you. Just listening to all the different code of ethics that Tricia was presenting, you noticed that the moral qualities were embedded in there. Respect, integrity, that genuineness is very important in how we behave day to day on the job. And from my experience in taking a look at the incidents that I have reviewed over the past 3 years, misconduct on the psychological end has been much more prevalent than on the actual abuse end, physical abuse end. So I wanted to give you some examples of incidents of misconduct that we've seen, and oftentimes as a response to someone who may not see our patients as a vulnerable population, may be under some great amount of stress, and not really aware of the language that they use when they are referring to our patients. So oftentimes it's derogatory statements, and we've seen a lot with sexual orientation of a patient, so understanding that we have to provide some cultural competence in terms of LGBTQ. Also, people are using harsh tones due to patients' attention-seeking behavior. And again, sometimes when we don't have enough tools to deal with the stress of a patient who has many needs and is being very forceful about their needs, we often watch our tone get stronger and stronger. Also, the use of profanity in addressing the patient and in clinical groups. I often hear that, well, this is the language that the patient speaks, and that isn't something that is something we should adhere to in a person-centered environment. So the use of profanity should never be used. It should be part of your code of conduct at your agency, and it's something that we continue to address on a regular basis. You know, oftentimes our patients aren't feeling well, they don't sleep well, so they're in group and they fall asleep, or they don't get out of bed when we've asked them to get up in the morning. We've had counselors kick the chair or kick the bed to awaken the patient, which is very startling to someone, especially someone who might have had abuse in their background. Also threatening a patient when they refuse to participate. So oftentimes when we're in that corner and the patient isn't doing what we ask them to do, staff will resort to something like threatening the patient. And then on the other hand, in terms of caring, and many of us are providing that caring piece, our patients don't feel well, and we get caught up in consoling them by maybe touching them or rubbing their back. And again, for those patients who have experienced physical or sexual abuse, touching can be misperceived, touching can be very scary, and so one of the things we talk about then is having approaches that are hands-off, that you can be very caring in terms of your words, your facial expressions, versus touching or consoling them in some way. So, empathy, in order to ensure that we're addressing the concerns of each person, we need to be in a position where we understand what each person might seek or want in order to best meet their needs. And so it's very important to listen to our patients, to find out what it is they want, and begin to take a look at how we might meet that. And that doesn't necessarily mean that we give the patient everything they want. It's about how we understand what they need in terms of their recovery. And this can only be done by putting ourselves into their shoes and seeing the world from their perspective. And that's the piece that requires empathy. A counselor who seeks to act ethically must also engage with the hopes, desires, and aspirations and fears of those of whom they interact. And without doing this, the counselor can only rely on stereotypes which negate the individual in favor of some sort of broad assumption. And then again, it's the slippery slope to misconduct in terms of the person's behavior. So what are those stereotypes, assumptions we make about our patients? And the reality is, under the disease of addiction, which is a disease of the brain, you'll notice here we have the common symptoms of addiction. And I want you to note the word that I have here, and that's common symptoms. So it's a symptom of the addiction, it's a symptom of the disease of addiction. And so when we take a look at these behaviors, we almost have to separate their symptoms of the disease in terms of who they are as a person. So oftentimes they're secretive, they're also engaged and focused on substance, the substance or the behavior. They lie. They begin to lose interest in their personal hygiene and grooming when they're out on using and coming in at the beginning of treatment. They may have financial problems. They may have issues of criminality. They have family problems. There's mood swings, depression, suicidal thoughts. And so as those symptoms elaborate during the treatment process, then we're in the position of reacting to that. And we have to remember that this is the symptom of their disease. When we take a look at addictive personality and behavior, still under the part of disease of addiction, we have a high degree of tolerance for criminal behavior. Our patients tend to act impulsively. They may have antisocial behavior. There's history of attention seeking, usually in a negative way. They have an admiration for rebellious behavior. They may be insecure, they may be anxious, and the hardest part that we all experience is they find it hard to wait for rewards. So they're relentless in continuing to ask whether it's a telephone call that they want to make, or they need to purchase something outside, or some sort of thing that they need and they can't get it right away, and they're constantly asking over and over for the same thing. And so that puts our staff in a position of reacting. And so we have to be healthy with our reactions in terms of dealing with the symptoms of the disease of addiction. So we have to act with empathy, and it's not just a commandment to act according to your feelings. It really requires you to engage with others on a rational as well as an emotional level in order to understand the variety of individual differences and to judge your actions appropriately. So the best way of learning empathy for others would have to be simply to talk to our patients. It's really important to listen to them and to understand from their perspective. And doing this is the best way to ensure that your actions are going to be in tune with the goal of promoting the good in those around you. So, learning to act empathically has 3 schools of thought in the literature, and it takes it a much more expanded view in 3 different areas in terms of how we understand empathy. First one being psychology. It allows us to understand individuals and their legitimate differences. So it's important with the individual why the person's coming into treatment. While everyone who's coming into treatment is hoping to gain a recovery, we have all had certain things that have happened to us in our lives that we need to address in treatment. So from the psychological standpoint, to be empathic, we need to understand the individual. When we take a look at sociology now, it's around, it's useful for understanding the differences between groups and for challenging the stereotypes inherent in the beliefs. So for example, as we have experienced this epidemic of opioid addiction, we've seen that our population has been adolescents and young adults, which is a different group of people that we've had to deal with over the years. And so what we have to understand is there's some differences in that group. And so we want to be able to address them in an empathic way and understanding that they're just starting out in life versus the patients that we had that were older and have had experience in their lives. So we're taking a look at empathy in terms of sociology. The last part is anthropology, and that's the differences between different peoples and societies and insights that allow us to have empathy for and understand the cultural variations that might seem important to us but not so important to others. So when dealing with patients in terms of cultural variations, sometimes that helps us understand where the patient is at. For example, if that particular culture, substance use is something that's frowned upon, then the patient's coming in with some shame. And so we need to understand their cultural differences in order to be empathic. So you see, we take it from the individual perspective, we take it from the group perspective, and then we take it from the cultural perspective in terms of acting empathically. This is really an important piece that I feel we needed to share with all of you today, and that's empathy fatigue. And what is that? That's a state of psychological, emotional, mental, physical, spiritual, and occupational exhaustion. It occurs as the helping professions are continually treating the issues of our patients and how they bring that to the treatment setting. Now, something that I personally talk about is I don't believe that we experience burnout. I believe we experience empathy fatigue. Burnout is often an indication that there's been an unresolved issue that we haven't dealt with necessarily in terms of how we treat others and how we process that through the supervision process. So I open your thoughts on empathy fatigue, because empathy fatigue is something that happens because it takes a lot of energy to be there for the patient and to work in a very respectful and honorable way each day with a population that has many challenges that come to us. Who it impacts? It really impacts all helping professions who primarily use person-centered and empathy-focused interactions to build rapport with their patients so they can achieve a therapeutic working relationship. And we know that the therapeutic relationship is the foundation of the work that you do in recovery. Also, what's important is to understand that some of us come into the field with impairments. And therapeutic impairment occurs when there's a significant impact on the counselor, nurse, or medical person functioning, which compromises patient care or poses harm to the patient. So just because someone comes in with an impairment, and what I mean by impairment is, you know, sometimes we come in with our own issues of depression, our issues of anxiety. We may have problems in our personal life. We may have life events that are happening. And we have to come into a setting where people need us. And so oftentimes it's very difficult if you're coming from a point of impairment into the treatment setting where you have to be there for that person. But I want to make sure you understand is that impairment in and of itself does not imply unethical behavior. And unethical behavior may be a symptom of impairment. So it may be that we're not feeling well that day, and then we come in and our patients are behaving in their symptoms, behaving in their personality and behavior, and it's very hard for us to act in an empathic way. So we have to be aware of what we're bringing to the treatment center. Also, the unethical behavior that may occur in someone who's not impaired. So it doesn't necessarily mean that if you do have something going on the other part of your life that you're going to be the most vulnerable for misconduct. People can always act in a way that's deemed as misconduct and not empathic. I can't emphasize enough how important wellness is, and we're going to devote one of our months in the next few months on actually counselor wellness. But part of counselor wellness, nurse wellness, physician wellness is receiving supervision. You know, it's important to touch base with somebody on an individual basis, not just that day-to-day interaction, but that individualized time where you sit down with someone, you find out what's going on. You might talk about that work-life balance and helping someone find EAP if they need it, just having someone to talk to, and or helping us understand sometimes the complexities of our patients. It's also important to discuss cases with colleagues, sometimes in the multidisciplinary team environment. While we're discussing cases together, we can see that a person who's carrying a particular case or person on their caseload, and they may be struggling with that, we might be able to give them that objective view. And so it's important to discuss the cases together as a group and be there for each other. Also, getting out and attending educational workshops to help you get more competence in dealing with patients who are difficult, who push you into a corner with trying to make a decision. Having those skills and tools in your back pocket make those difficult situations go much smoother And so it's really important to provide that for staff. Something that I always say is important is eating healthy, getting enough sleep and exercise, getting out in the middle of the workday maybe and taking a walk, assuring that you go to bed on time, and eating healthy, trying to bring your own lunch versus bringing in those heavily laden lunches that we often see at our treatment programs. If we're feeling well, we're going to be able to handle stress, and we're going to be able to handle the challenges our patients bring with us. Also, having that work-life balance, spending time with family and friends, travel, vacation, hobbies, movies, and for some of us, developing a spiritual life, whether that's a particular religion or something that you feel is important and in your life to nurture that spiritual piece. So as I said before, we're going to spend some time on counselor wellness in one of the upcoming topics. So I thank you. These are the references that we have associated with this particular presentation, and I'm going to turn it over to Tricia.
Thanks, Maria. So this actually concludes our presentation. I did just want to share with you that we provided our contact information. So if you have any questions or would like to reach out to us, my name is Tricia Allen, and I can be reached at tricia.allen@oasis.ny.gov. And if you have questions for Maria, you can reach out to her at maria.passeri@oasas.ny.gov.
Well, I want to thank you, Tricia and Maria, for this informative and relevant presentation. We welcome our viewers' feedback. It lets us know if we are meeting the educational goals and objectives of the field that we all work in. We ask that once you have viewed this presentation and completed the quiz, please follow directions to access the SurveyMonkey link and offer your feedback there. This concludes today's presentation. Thank you for joining us, and enjoy your day.